From VOA Learning English, this is the Health Report. In the United States, hospitals with the best resources to treat injuries are known as trauma centers. One of the largest is at the Los Angeles County University of Southern California Medical Center. Dr. Dimitrios Dimitriadis is the Director of Trauma Services at the hospital. He says when a trauma team is activated, all the members are expected to be ready within 5 minutes. This happens before the patient even arrives. Every member of the team has a job to do. Dr. Dimitriadis says this methodical way of treating patients in the trauma center has greatly reduced preventable deaths. Other trauma care changes have also improved survival rates. One change involves emergency medical technicians and paramedics. These first responders are often with local fire and rescue departments. They can start treatment in the field while communicating with doctors at the hospital. But Dr. Dimitriadis says the thinking now is to avoid any delays in transporting seriously injured patients. The new policy is known as scoop and run. Another change is that the hospital does not always operate on patients with gunshots to the abdomen. Avoiding surgery reduces the risk of infection and other problems. Some lessons in trauma care have come from the wars in Iraq and Afghanistan. Dr. Dimitriadis says one lesson is to not give trauma patients large amounts of saline and other intravenous fluids. Patients are given fresh blood products instead. Changes like these have improved the chances of survival in trauma centers by as much as 25%. For VOA Learning English, I'm Mario Ritter.
From VOA Learning English, this is the Health Report. A new study has found that Americans are generally in good health, but some may be living with chronic disease longer and dying younger. Even without the study, some Americans seem to understand that a long life does not necessarily mean a healthy life. Christopher Murray from the University of Washington led the study. He says Americans are spending more years of their lives with long-term diseases. Researchers studied the major diseases and injuries that were at least partly to blame for Americans' health problems and early deaths over the past 20 years. They found the leading causes of chronic or long-lasting disability include depression, anxiety, and back pain. Other leading causes are diabetes and lung diseases that block airflow and make breathing difficult. The researchers identified heart attack, stroke, and cancer as the leading causes of early death. Dr. Murray says too many Americans are dying at an early age because they smoke or eat too many of the wrong foods. He says poor diet is blamed for 680,000 deaths. That is more than the 400,000 deaths a year from tobacco use. Obesity and high blood pressure are other conditions responsible for poor health. Another concern is air pollution. The National Institutes of Health says air pollution has been linked to heart and lung diseases. There was also good news from the study. It showed that Americans are generally enjoying better health longer. That is because of better methods for treating stroke and fighting some cancers. But it also found America is behind other wealthy nations in improving the health of its citizens. For VOA Learning English, I'm Alex Villarreal. From VOA Learning English, this is the Health Report. Experts estimate that 275,000 women worldwide die of cervical cancer each year. Cancer of the cervix kills another woman every 2 minutes. 85% of the women live in the world's poorest countries. In richer countries, this kind of cancer is more often diagnosed early and treated. Cervical cancer is usually caused by the human papillomavirus. HPV is spread through sex, but a vaccine can protect against it. The vaccine is generally given to girls between the ages of 9 and 13. The HPV vaccine is given 3 times in 3 separate doses. It only works if someone has not yet become infected. Now, 2 big drug companies have agreed to lower the price for the HPV vaccine for poor countries. The Global Alliance for Vaccines and Immunization, or Gavi, announced the agreement. Seth Berkley is the Chief Executive Officer for Gavi. He says the alliance hopes to provide the vaccine to 30 million girls in more than 40 countries by 2020. Under the agreement, Merck and GlaxoSmithKline will sell their HPV vaccines for about $4.50 for each dose. Until now, the lowest price for poor countries was $13 per dose. The vaccine costs more than $100 in developed countries. Kate Elder is with the medical aid group Doctors Without Borders. She says the new price is still too high. She says the drug companies have earned enough profit from vaccine sales. GlaxoSmithKline says the price has to be high enough so that company stockholders earn money on their investment. But Kate Elder says the drug companies should be more open about how much it really costs to make the vaccines. For VOA Learning English, I'm Alex Villarreal. From VOA Learning English, this is the Health Report. Malaria kills about 200,000 newborn babies and 10,000 new mothers every year. Most of these deaths are in Africa. Malaria can also cause mothers to lose their babies before they are born, or cause a baby to be born early. There are low-cost ways to prevent malaria infections, but a new study finds that many pregnant women do not receive these interventions. For example, the World Health Organization has advised pregnant women in areas with high rates of malaria to sleep under bed nets treated with insecticide. The WHO also advises them to get what is known as intermittent preventive treatment, or IPT. This treatment involves taking a low-cost anti-malaria drug at certain times in their pregnancy in an effort to prevent the disease. The WHO recommends that pregnant women receive the medicine during visits to a clinic. Many pregnant women and new mothers go to medical clinics in sub-Saharan Africa. Yet researchers say only about 21% receive intermittent preventive treatment during their pregnancy, and less than 40% are given protective bed nets. Jenny Hill from the Liverpool School of Tropical Medicine is program manager for a research partnership called the Malaria and Pregnancy Consortium. Ms. Hill says a review of 98 studies found a number of barriers to malaria prevention. These include unclear policy and guidance from government and healthcare officials. Other problems include drug shortages, a lack of clean water, and confusion about how to administer IPT. Ms. Hill says countries can save lives by following the WHO policy on intermittent preventive treatment. For VOA Learning English, I'm Alex Villarreal.